Welcome to tonight's webinar. This is Nourish to Flourish, Reducing Inflammation Through Nutrition. I'm Dr. Tia Jackson-Bey. I'm a reproductive endocrinologist and infertility specialist here at RMA of New York. Definitely like to also see myself as a patient advocate as well as community educator. And that's why we really wanted to bring this information to you. I am so excited to join Dara's presentation, really. We talked about this a few months ago and just thought that it would be such a hot topic. And so I'm really excited for tonight's talk.
I'm really honored to be here with Dr. Jackson-Bey, who I really admire. As she had mentioned, I'm very thrilled about this topic. I am the registered dietitian at RMA of New York since 2010. I was a patient there around that time and have two IVF babies. And I'm also a co-host to our podcast, our RMA podcast, Fertility Forward, of which Dr. Jackson-Bey has been on a number of times. And we're just thrilled that we are a part of this community. It's quite a clinic. We have over 20 reproductive endocrinologists, many fertility experts. We have 14 clinics and offices across New York. And alongside, phenomenal reproductive endocrinologists, we also have this robust mental health team, as well as myself and another dietitian to really provide, hopefully, the best care to our community.
I completely agree. Well, we thought that we would just start by, laying some groundwork in terms of definitions. And obviously, one of the biggest ones is what exactly is infertility? So infertility is a disease of the reproductive system. Yes, it can have male or female components, but essentially that is the definition. And I'll go a little bit further. So traditionally, we talk about, the failure to achieve a pregnancy after 12 months of unprotected intercourse. This has been like the traditional definition. We've actually updated this definition to be more inclusive of all the different ways that people need to build families. And so it's more about the need for medical intervention to achieve a pregnancy, with whether you're by yourself or with a partner, or if you need any use of donor gametes such as eggs or sperm that may be lacking in your relationship. So there are lots of different kind of ways that we think about the etiology of infertility. Yes, there can be male factors, there can be female factors. And the reason why I love this graphic is because I always like to drive home the point that it is pretty much 50-50 between male and female issues. In some cases, there are going to be, times when there's a male and female issue in the relationship. And then another slither, which is really important, unexplained infertility, which I know can be particularly frustrating, but it's important to know that you're in good company. There are a lot of people who fall into this 10% category of unexplained. If we look more on the female side, the majority of infertility worldwide is due to some degree of ovulatory dysfunction, which means either not ovulating normally, in both ends of the spectrum. Women with PCOS, who usually have lots of eggs, but may not be growing and releasing those eggs at a regular cadence, or women who have a very low egg reserve, low ovarian reserve is a term you hear us say a lot. It could be due to age, it could be due to medical treatments, intervention, a lot of reasons unknown, but that ovulatory dysfunction plays a huge role in terms of causes of female fertility. Tubal disease, whether the tubes are blocked, scarred, removed, all play a role in, contributing to infertility. Remember, the fallopian tubes are where sperm and egg meet. So if there's any damage or blockage to the tubes, it prevents that meeting of sperm and egg and the growth and development of the early embryo. Endometriosis still constitutes a significant portion of infertility for women. We'll talk a little bit more about that. But something that kind of underlies all of these conditions, or the majority of the conditions represented here, is actually inflammation. It can be present in different ways throughout many different disease pathways that can lead to infertility. So a part of why we think of, well, why would there be inflammation? Any dysregulation of the natural hormones associated with reproduction and fertility, if those hormones are unbalanced or off, it could contribute to a pro-inflammatory state. So estrogen is one hormone that we hear about a lot. It's made predominantly by the ovaries from the conversion of testosterone into estrogen, but it has so many different impacts outside of just your reproductive health. It's so important for your bone health, for normal liver function, for your cardiovascular health. I have skin and hair here. Estrogen is a really important component of having healthy skin and hair, and that's why as you get older and your estrogen wanes, you may see issues in that regard. Breast development, and then also cognitive function and brain health too. And that's why, there's an increased risk of even like conditions like dementia, Alzheimer's in older women, the longer they go without having this regular estrogen. On the other side, progesterone, which is kind of like this counter or balance to estrogen, is also super important. Similarly important in cognition, in your reproductive health, breastfeeding, and gestation. Progesterone got its name from progestational hormone. Once we found out what this compound was, they named it after that. But also has big impact on your mood and well-being, on your metabolism, including thyroid function, as well as these cells at the bottom. Progesterone is super important in terms of regulating your immune function. Progesterone dominance during early pregnancy is needed to kind of calm the immune system and to allow the early pregnancy to flourish. And so when you don't have this balance of estrogen to progesterone, you can be a little bit more pro-inflammatory in state. So just a reminder that inflammation, even though we think of it as a bad thing, it's actually a normal bodily process. Inflammation actually keeps us safe. It's the process by which your body responds to infection or injury. So in the acute phase, it's dominated by, a very specific type of white blood cell, neutrophils. We think of these as like the first responders, like they're first on the scene, they're figuring out what's going on, they invade the tissues, they actually move out of the blood circulation, get into the tissues, help to fight infection, and then also help to recognize what the infection is so it can get the next line of cells ready. So super important. More chronic inflammation is what happens in the next phase. So these are not like the first responders. I always think of these as like the insurance adjusters or something. They come back to the scene, they surveil, they want to know why things happen, what's going on, they're maintaining security. And so this might be a more long-term reaction in terms of different types of cells present, macrophages, different types of cellular changes too, as neutrophils might be that initial response with warmth, erythema, redness of the skin, swelling. The type of inflammation that's dominant in the more long term is not as much swelling, but also structural, like cellular remodeling, how you form your skin cells back together after you had a cut. That is in terms in some terms regulated by long-term inflammation. However, you can have too much of a good thing, obviously. If this is prolonged, if it's chronic, if it's unchecked, if the condition that is causing the inflammation is not adequately treated, then this kind of more long-term inflammation, it can definitely have impact on fertility. And so there are lots of different inflammatory processes that impact fertility. Endometriosis is going to be one. We'll talk about it a lot today because it is Endometriosis Awareness Month, and one that, is just heard so frequently in the fertility space. And so definitely want to make sure that we, talk about it. But polycystic ovarian syndrome is also associated with inflammatory process in a different way. Again, that estrogen dominance, especially from women who are not ovulating regularly, they don't have that kind of calm down in the second half of your cycle with the progesterone. And also some of the other factors involved in PCOS, like having higher levels of androgens, higher levels of blood sugar and insulin, also kind of creates a pro-inflammatory state. I mentioned diminished ovarian reserve, kind of like the opposite end of the seesaw from polycystic ovarian syndrome. Again, it's dominated by unbalanced hormones, and sometimes having that testosterone increase can increase the inflammation. Fallopian tube disease, the most common reason why fallopian tubes are damaged is due to actually infection, and kind of a hyper response to treat the infection causes damage in the fallopian tube. So when you think of fallopian tube issues, you may think of, is there an active or a subacute or chronic inflammatory process happening as well? And if we see that with dilated fallopian tubes, we may say, oh, maybe we remove this fallopian tube. So we remove this nidus for infection and inflammation, and not have any impact on the chances to get pregnant with assistance. Uterine fibroids, also really commonly found in the infertility population, can also contribute to their own inflammation. Chronic pelvic pain, if you think about the sources of pain, sometimes they are infectious, like a prior infection, or fibroids, or endometriosis, or even issues with the bladder or bowels definitely can, kind of lend to this inflammation process. A history of pelvic infections, and a term that you may hear, chronic endometritis, which is like a post-inflammatory process, all can impact fertility. There are a few other things that you don't really think of as fertility related that can also impact fertility. Chronic medical conditions, particularly if they're not well managed, things like high blood pressure, diabetes, even asthma, a respiratory condition. But if your body is constantly trying to address this issue, it can take on some pro-inflammatory factors. I think of it as very stressful. Even chronic anemia can increase your inflammatory markers. Thyroid disorder, again, the thyroid is the major kind of regulating hormone for our metabolism and does so much. I think the thyroid is almost like the conductor of our body's orchestra. If the thyroid is not happy, no one's happy. So, making sure that that's in order to keep your immune system in check is really important. By definition, autoimmune disorders means that your body is having an issue with with visualizing or with recognizing its own cells as self, and starts to attack its cells as other than. And so that shows us that there's something kind of amiss in this recognition process of those either short-term or long-term cells, and there can actually be destruction of cells. And that can include the ovary as well. And so sometimes with autoimmune disorders, this kind of constant heightened inflammatory response from your immune system can cause, a degradation of ovarian cells, of eggs, of your thyroid hormone, much earlier than we anticipate. Inflammatory bowel disease, things like Crohn's and irritable ulcerative colitis can, again, marked by lots of inflammation, lots of adhesion formation in your bowels, and even sometimes poor nutrition, or a nutrient uptake as a result. So just to give you a few examples of different conditions that can cause more inflammation and may impact your fertility. Inflammation, again, it causes this overactivation of the immune system. It can impair hormonal signaling that is really important in, trying to get pregnant or trying to have a safe and a successful pregnancy. It may actually, if your body's in this, heightened state of inflammation, it may not be the best time to start treatment, because you may not have the best response to treatment while your body is like attention is dragged somewhere else. And so really important to try to do everything you can to calm whatever condition is causing the inflammation before getting started. As I mentioned, sometimes inflammation can impact nutrient absorption from the gut, particularly if you have a GI related issue. Additional scar tissue formation, like when we think of what happens after a surgery or after a pelvic infection or conditions like endometriosis. And that scar tissue can distort pelvic anatomy. It can, make the uterus turn a certain way and make the fallopian tubes really turn. And that can, not only lead to pain and discomfort, but also make it physically harder to get pregnant. So back to endometriosis, just to talk about it a little bit more. It is a relatively common disorder. It impacts 25 to 50% of women with infertility, but of women with endometriosis, up to half of them may have fertility issues. And so, really thinking about one, how common this is, two, how underdiagnosed it is. On average, it may take women about 10 years to arrive to the proper diagnosis of endometriosis, and probably seeing 2 to 3 doctors during that time before they get to someone who says, you know what, this is probably what you have. The biggest hallmarks of endometriosis, again, thinking inflammation, are pain. So we are always taught in medical school, like the 3 disses. It's dysmenorrhea, which is painful menses, dyspareunia, which is painful intercourse, and dyschezia, which is pain with defecation. And I put pain all the time because that's really what happens if you've gone with endometriosis that's been not addressed and not treated. Essentially, it becomes pain all the time, not just during these activities. So what exactly is endometriosis? You see on the left, the schematic of like the uterus with the fallopian tubes out to the side, like a flying bird, and the ovaries on either side. In your body, nothing is spread out like this. Everything is soft and kind of curled together. And because of that, the endometrial cells, if they are somehow present outside of the endometrium. So the endometrium is the lining of the uterus. It's this dark red part on the picture on your right. And that innermost portion that makes that inverted triangle is the endometrium. These are the cells that should exit the uterus every month when you have a period. Except in endometriosis, those same cells are present in the wrong places. So some of them burrow into the actual muscle layer of the uterus, which can be a condition called adenomyosis. Sometimes those cells are present in the fallopian tubes or find themselves on the ovaries. They can also be present on the bladder, the bowel, any adjacent structures, your diaphragm, and have even been noted in the lungs because the fluid from the pelvis kind of moves up and can get to the lungs through little small perforations in the diaphragm. Can also be found in surgical incision scars that shows that for some reason, these cells were transplanted in the wrong place, keep growing. And they shouldn't, but that's what happens with endometriosis. They have these hormonal inputs, normal from the ovary, but they're in the wrong location. So these cells grow and proliferate, and then when the cells should die, they do. And they try to, but your body doesn't have a way to recognize why are these cells dying. And let's wall them off and protect the rest of your body from them because we don't know what's going on here. And in that process of trying to protect yourself, it actually forms adhesions, it can form scarring, and you can also form cysts in your ovaries from these endometrial implants, which we call endometriomas. So I like this graph here on the right because it shows the close proximity between the uterus, which is in the middle, with the fallopian tubes extended, the bladder, which is to the left, and your colon, which is to the right. All of these structures are really just sandwiched together in your body. They're very close quarter partners. So if there is issues with, endometriosis and scarring, then that, the adhesions can form between these different organs. And that's part of the reason why you can have painful urination, painful bowel movement, painful intercourse from endometriosis, because all of these things start to become connected like cobwebs. So your pelvic anatomy becomes distorted. Even the function of the peritoneum, which is the inside lining of your pelvis and abdomen, is to kind of keep things calm, to surveil, to make sure everything's moving and nice. But if there's chronic inflammation there, then certain inflammatory cells are present in altered numbers, too high, and that can impact hormonal functions, what we call cell-mediated communication. Two cells live next to each other, and they know what to do based on their relation to each other and other ways that cells communicate. But if you distort that function, then now those pathways don't happen in the same way. And so there can be, we discussed before, endocrine dysfunction, ovulation dysfunction, which means you're not ovulating at the regular times. The ability of the embryo to get from the fallopian tube to the uterus in enough time to implant becomes impaired. And so women with endometriosis may also have a higher risk of having an ectopic pregnancy or no successful uterine pregnancy because of this impairment with implantation. Another thing that we don't think about a lot is this chronic inflammation can be really detrimental to ovarian tissue. The ovaries are very, very delicate, and they don't like to be bombarded with immune cells. And so if it's an autoimmune disease or something like endometriosis or other inflammatory factors, they really shrink away from it like a little shrinking violet. And so that can impact egg quality, as well as embryo quality in women who have this kind of chronic or persistent inflammation from endometriosis. So, there are lots of different treatment options for women with endometriosis, and anyone who's lived with this has probably been through a few. We typically start with medical management, meaning, addressing your pain, trying to reduce prostaglandin formation with NSAIDs, non-steroidal anti-inflammatory medications. A lot of time, hormonal contraception is actually our friend with endometriosis because it can stop your own ovaries' hormonal input to those cells, and then they kind of die off over time, or it allows, to decrease the scar tissue and pain from menses. Aromatase inhibitors such as letrozole are now being used more commonly, as well as GnRH agonists and antagonists. Sometimes you hear about people getting started on Lupron or taking new oral medications like Orilissa or elagolix, as well as antidepressants, both taking for mood as well as how they can modulate pain receptors in the pelvis. Surgery may be indicated. Sometimes that means lysis of adhesions, excision endometrial implants. The goal would be to restore normal pelvic anatomy, reduce pain, and sometimes reduce just the bulk of, ovarian cysts and things like that. Persons with endometriosis may have to have fertility treatments, including surgery, IUI, and IVF. In some cases, egg donors may be required if there's significant impact to egg quality due to the condition, or have to have a gestational carrier if their scar tissue or prior surgeries make it too difficult to carry a pregnancy. I'd like to always just remind anyone who may be suffering or knows someone who's suffering that this is a chronic condition. It is, as far as we know, can be lifelong. It should really, really mellow out after menopause, because then the ovaries aren't making the same kind of hormones. But before you get to that point, if you've ever been diagnosed, I want you to check in with your providers regularly. Ask about surveillance. Should we have imaging? At what interval? How do I manage my symptoms? And for young people who may not be ready for, pregnancy now, but know that they have this diagnosis, How can I preserve my fertility for the future? Because doing something like egg freezing or embryo freezing in women who have endometriosis can be a really important part of kind of making sure that they have options for themselves later in life. We're going to talk a lot about, some different lifestyle modifications, including exercise, diet, supplements. Just wanted to remind you that there are also, supportive measures in terms of seeing pain control therapists and pelvic floor physical therapy.
So now I'm going to take over to talk about more of the modifiable components. Especially it's so wonderful that there's a lot of potential treatment options, but I would presume that a lot of you want to, those people who have endometriosis, to feel like you have something that you can take ownership of, that you can really make a difference through diet, lifestyle, and through supplements that really have the potential to help lower inflammation and ultimately, hopefully, reduce pain if that is a concern, supporting hormonal balance, and just really improving your overall quality of life. So let's first talk about what I do as a dietitian. Let's speak about food. And I really love this quote that I feel like many health professionals can probably appreciate. Nutrition is the foundation of healing. With endometriosis, every bite can either fuel inflammation or fight it. So let's talk about first what can be a potential fuel. Um, and, in the research that that's available, we find that women who have endometriosis typically are consuming fewer vegetables, fruits, and fewer foods that are rich in omega-3 fatty acids. And on the flip side, we're seeing um, people with endometriosis are typically consuming more fried foods and other unhealthy fats, including trans fats. Not only these unhealthy fats, but on top of that, foods that are higher in sugar or foods that have the propensity to spike inflammation and increase one's blood sugar. So typical average American diet, what we're eating nowadays, coming from very ultra processed foods, foods that are packaged, foods that have many ingredient lists in it, typical high fat, high sugar diet, which can, again, fuel the inflammation fire. When it comes to alcohol and caffeine, the research is somewhat mixed, a little bit more when it comes to alcohol, how it may be detrimental, that it can really trigger more of this chronic inflammation, create more hormonal imbalances, specifically increasing estrogen levels. And when it comes to endometriosis, it's typically a condition that's estrogen dominant. So again, we don't want to put fuel on that fire. So really trying to, alcohol may not be the best thing. When it comes to caffeine, although there are some health benefits to caffeine, um, we still do see in terms of research that caffeine may not be the best. It may actually aggravate more of those endometriosis symptoms, especially the pain. And I also think it's what we put in our coffee. If we're getting caffeine through coffee, if we're adding in a lot of these sugars, if we're adding in a lot of the hydrogenated oils or those creamers, which are very common. And then the last line, there's a lot of question marks in that the research is mixed, but I did want to bring it to people's attention. As Dr. Jackson-Bey said before, people with endometriosis often, or inflammation in general, often have a high propensity for autoimmune issues. And sometimes we see people with endometriosis also have autoimmune issues like celiac disease. So gluten in those people definitely can fuel that fire. When it comes to red meat, again, the research is mixed, but especially with processed meat, that can increase some hormones that may not be great for endometriosis. Dairy also mixed. Sometimes some research shows that dairy can be really healthy and be a great component in patients with endometriosis. But especially in those people who are much more sensitive to dairy, that can actually create more inflammation. And the last one I like a lot is seed oils. We're hearing a lot more about it in the media. And when we think of seed oils, think of things like soybean oil, corn oil, canola oil. And these oils we're now seeing maybe a big contributing factor not only to chronic inflammation, but to overall disease. And you'll see the common theme here on this page are mostly foods that are providing minimal nutritional value and again, fueling the potential fire. On the flip side, there are so many things that we can do that really can make a huge impact to relieve endometriosis symptoms and create a better quality of life. And I like to start with antioxidant-rich foods. So antioxidants are these vitamins and minerals and other potentially good bioactive chemicals in our foods that have the potential to protect our cells from damage. Or another term for that is to protect our cells from oxidative stress. And oxidative stress is definitely linked to endometriosis progression. So eating these antioxidant-rich foods can really help protect our body. And so looking at foods that are rich in vitamin C, think of citrus, but on top of that, there's so many other fruits and vegetables that are high in vitamin C. I also try to think of things that are seasonal. So, looking at strawberries more in the summer, but kiwis are a great thing to have now, bell peppers. Vitamin E, also a really rich antioxidant. And vitamin E is a fat-soluble vitamin. So think of a lot of healthy fats. So it's kind of the flip side of the trans fats and the unhealthy fats on the previous slide and looking for more heart healthy fats coming from olive oil, avocado oil. Avocado oil is a great alternative to a seed oil in terms of when you're cooking with food on high heat. Avocado is a much better option. And I like suggesting olive oil when you are, especially extra virgin olive oil, when you're topping off your salad. It's a great healthy oil. But you can also get vitamin E through nuts and seeds. Other rich antioxidants come from polyphenols, and I really like to promote dark chocolate. People often think chocolate isn't great, but it is a really good antioxidant. So, a daily dose of a dark 72% dark chocolate square can be great. Green tea, also one of my favorite antioxidants. To actually get the most impact out of green tea, squeezing some lemon, some acid really helps bring out the antioxidants. And pomegranates, which I had as part of my snack today, really high source of polyphenols. Resveratrol from grapes and blueberries, also from alcohol, but something to minimize. But if you are to choose a little bit of alcohol, red wine is very rich in resveratrol. Think of orange-rich vegetables. Carrots, sweet potatoes, pumpkin are a wonderful source of beta carotene, or a vegetarian source of vitamin A. And then think of herbs and spices, the basils, the oreganos, the cinnamon, turmeric. You're going to be hearing a lot of me speak about turmeric. It's really such a powerful spice, and it's actually the curcumin is the active component of turmeric that really serves as a really powerful antioxidant. In order for the antioxidant to come out, similar to the squeeze of the lemon in the green tea, you really want to pair turmeric with black pepper to bring out the most antioxidants. And then the last component is selenium. One Brazil nut a day gets your dose of selenium in. Um, and then we also want to look at, no surprise, foods that can help lower inflammation. And so the antioxidants can be protective, but the anti-inflammatory foods can really help the body return to normal after you already have the inflammation. So it can help lower that chronic inflammation in your body. Healthy fats, fatty fish that are really rich in omega-3s, your salmon, your sardines, your anchovies, all very powerful anti-inflammatory foods. Back to other fats, olive oil, avocados, you'll see an overlap with a lot of these foods that I'm mentioning. They're both sometimes antioxidants and as well as anti-inflammatory foods. But I really want to highlight cruciferous veggies, both broccoli, Brussels sprouts, cauliflower, really healthy for us. But Brussels sprouts in particular, they are great, in order to support estrogen metabolism. So very seasonal, great in the winter. Now's your time to get in your Brussels sprouts. as well as leafy greens. So think of, bright, colorful vegetables. Turmeric, again, not only anti-inflammatory, but also an antioxidant. Ginger, which I love ginger. You can use ginger spices when you're cooking dishes, but also fresh ginger. My daughter is at home not feeling so well, and I make tea, fresh tea, where I add in, lemons and orange peel, but also some ground ginger, as it really can help not only with inflammation, but also help support digestion. So great for your GI tract. Berries, so powerful in terms of anti-inflammatory, antioxidants. And then again, green tea, a super great addition to your tea repertoire.
I love, go back one side. I love this
Oh, yeah.
whole slide because it almost feels like a mix and match to make your own meal.
Yeah.
Like, take a little bit of this and a little bit of that, or you wanna do a salad, or you wanna do a fatty fish with some, dark leafy greens with a little ginger on it. Like, you literally can get a little bit of this in all day. It does take intentionality, but I think having lists like that, and you're more than welcome to, like, kinda screenshot things, can really help you to figure out, like, I don't really eat this too often. How can I add these things in? Or how can I look to help me add a little lemon to my green tea is like my peanut butter and jelly. I actually think it helps the taste,
It
but
does.
I'm glad to know that it also helps to bring out the antioxidant properties.
Yeah, and even what I love about pomegranates, we often think of something sweet, or even like blueberries. Like, why not add that to a salad?
It's the best.
I love
Oh,
adding pomegranates to Brussels sprouts even. So then you can get
I've seen
the
that.
double whammy. You get the sweet and the bitter.
Yeah, I'll try it.
And then even avocados, adding that to your sardines and making an avocado sardine sandwich can be great too. So you're right, a lot of mixing and matching, which you'll get a little taste of in the end with the recipe. And then this is one area that is not necessarily spoken enough, but I do in my practice speak a lot about the importance of fiber-rich foods. Really important to help regulate estrogen levels, um, on top of helping with your bowel movements and also creating that healthy uh, gut support. And I loved how Dr. Jackson-Bey spoke about before how inflammation, there's so many different avenues that can create inflammation, and your gut really plays a big role in helping keeping that inflammation at bay. So it can either fuel if you're eating a lot of these unhealthy processed foods, but what can help kind of clear the gut out is foods that are rich in fiber. It helps kind of take out the junk, so to speak, the cholesterol or some of the other things that really are not meant to be in your body. So yes, alongside those fruits and vegetables, I do want to add whole grains, beans, legumes, and specifically flax seeds, which also have this um, really healthy to help with estrogen metabolism, to include some flax seeds into the mix of your day-to-day diet. I like putting it in breakfast and over oatmeal or some form of yogurt. Um, Diet. People like to look at diets. Is there a best diet? And I don't really believe that there's a single best dietary intervention. And at least with research, we don't see that there's a gold standard, so to speak. I don't even love the term diet because it often, makes people think that it's very restrictive. But overall, these are the ones that have been the most researched in relationship to inflammation, in relationship to endometriosis. I particularly have an affinity to the Mediterranean diet, just because it does incorporate all those components that I mentioned previously, your fruits, your vegetables, your healthy fats, and those high fiber foods. But again, as Dr. Jackson-Bey said before, that IBS, irritable bowel syndrome, is something that can be linked to inflammation, and it is something that I often see in my endometriosis patients also experience that like gassy, bloated feeling. They may benefit from the added low FODMAP diet, which is very specific. But on top of that, I also see a connection with people with celiac disease and endometriosis. And like there's a genetic risk factor often connected, like there's an inflammation component. So a gluten-free diet may be helpful, but keep in mind, gluten-free alternatives are not necessarily a better alternative. You know, a lot of those gluten-free breads may have a lot more processed, high sugar components in them that are not necessarily a better alternative. So when in doubt, whole nutrient-dense foods is really what you should be looking at to have the majority of your diet to really help lower inflammation. So now let's kind of, you know, it's part of diet, but your lifestyle factors really are make a big contributing factor in feeling great or really not feeling great. And I think stress is one of the more challenging components, but there's definitely this bidirectional relationship between stress and endometriosis. Not that stress causes endometriosis, but when we are stressed from outside, you know, we're living our life, that can further irritate some of those endometriosis symptoms. And endometriosis and that inflammation in itself and the pelvic pain and the pain in general can also create stress. So, you know, finding ways to help lower your stress, so important. I think I love the idea of being in nature. Maybe not today when it's rainy outside if you're in New York, but you know, on a nice day, getting outside, um, whether it's meditation or focusing on your breath, having a gratitude practice. I speak to my patients a lot about the importance of, you know, reflecting on three things that you're grateful for during the day can really um, be a wonderful way to help lower your stress. And then things like warm baths and heating pads can also be helpful to control some of the pain or at least minimize some of the pain that may be experienced. Exercise, we think exercise is great, which it is, but it can also, certain exercises may fuel inflammation in your body. So really being mindful of minimizing that high impact, that high intensity exercise, which has been found to really increase inflammation in the body. You know, if it's something that you love, here and there can be okay, but I really do like to emphasize more of the gentler, calmer forms or modalities of movement like yoga, Pilates, swimming, and walking. And then people don't really speak too much about sleep hygiene, but I do really believe that if you don't sleep well, doesn't matter how much you exercise, it doesn't matter how much you meditate, how well you eat, your body is not going to have that chance to repair and recover. That's what sleep's all about. I'm not sure if you
Yeah,
agree with
no, that's actually scientifically proven. So sleep is a biologic need for us as, you know, human beings as a species. And so that time in rest and getting adequate rest and good quality rest is super important. You know, when you have disrupted sleep, disordered sleep, you don't sleep enough, that it hugely elevates a lot of inflammatory markers and contributes to chronic medical issues, either, you know, kind of contributing to their development or worsening. So I was just talking this week to someone about being evaluated for obstructive sleep apnea. You know, loud snore, works odd hours, I don't sleep that much, but also battling weight, battling high blood pressure, you know, and I snack a lot. And I said, well, you snack a lot because you're hungry. And also all your inflammatory factors are like, you know, on edge if you slept better with better quality sleep. And sometimes that means, you know, if you have obstructive sleep apnea, sleeping with a CPAP, you
that.
know, it'll reduce that inflammation, reduce, you know, one of the big factors, cortisol, which allows you to have like excess abdominal fat. But these things can also interrupt other hormonal pathways and contribute to, you know, having a hard time getting pregnant.
Yeah, I love that you said that in terms of like when you don't sleep well, your cortisol levels are increased. But it's interesting that it also negatively impacts our estrogen levels. So estrogen levels are
Mhm.
also increased. So you get the extra estrogen, the extra
Yeah,
cortisol, the, you know, wake up extra hungry, craving less nutritious foods.
yeah.
So sleep's very important and getting that good quality or getting the good habits that can help ensure good quality sleep is really important. I often recommend people reading the book that Dr. Matthew Walker wrote, and he's on a lot of podcasts, but he is like the king of sleep and you know, not eating too close to bedtime, you know, dimming the lights. I wear the blue light glasses if I'm reading my Kindle, and you know, listening to calming music and you know, maybe having a gratitude practice. So the last couple of thoughts before bed are something positive. So there's a lot of things that you can do to really help optimize your sleep. And then the last thing I wanted to speak about regarding lifestyle factors, we do see this link. There's, no definite cause of endometriosis, but there is a strong link between, um, you know, higher toxin exposure or exposure to more endocrine disrupting chemicals and people with endometriosis. And so it is something that we need to look at and certain areas where we really can work towards minimizing our overall toxic exposure. And so the things that I like to kind of briefly touch upon, pesticides and herbicides, a lot of the sprays on our food. I don't think everything needs to be organic, but definitely the dirty dozen, those types of foods and vegetables that absorb the most pesticides really should be organic. When it comes to fish, opting for wild fish versus farmed salmon, which are very high in PCBs. Phthalates, which is also getting a lot of press nowadays, these forever chemicals, and BPA, which we've also probably heard of, which are both found in plastics. So, opting for the glass, opting for your metal water bottles versus your plastics. It can also be found in canned food liners. So like if you're having your, tomatoes in a can or even soda cans, there's BPA oftentimes inside. Our cosmetics, which is so sad, but I love nowadays there's a lot more of the clean beauty and there's some great resources. Like I love using the app Yuka to really, scan your product to see if it has a lot of these toxic chemicals. And then the heavy metals, which we find, unfortunately, in a lot of our water supply, in our food supply, but a little bit can go a long way. And I don't want people to get worried that it's in everything. Making small changes here and there can really make a big difference in lowering our inflammation. And then the last component is supplementation. I do think food first. I do think those lifestyle changes are great, but as the name suggests, supplementing is a great supplement, a great addition, a great insurance policy that has the potential to support your health. And, back to the antioxidants, looking at antioxidant-rich vitamins, your vitamin C and E, alongside food may be helpful to get also in your vitamin form to help lower oxidative stress. As I mentioned, curcumin, that main component that found in turmeric, alongside getting it from food and adding that pepper, you may benefit from a supplement of curcumin. Omega-3s, I recommend to almost all my patients, especially if they're not eating a lot of the those fatty foods like the salmon, which I think is still great to have. But the omega-3 supplement has the potential to help with inflammation. Vitamin D. I'm not sure if you see this, Dr. Jackson-Bey, like I see a lot of my patients nowadays deficient, and we do often see there's a potential link between vitamin D deficiency and endometriosis. So I do think it's important to get your
Vitamin D deficiency is being linked to almost everything on earth.
everything,
I think we're
PCOS.
all, a bit deficient, and I talk about it a lot in other inflammatory processes like uterine fibroids are associated with vitamin D deficiency too. So
Mhm.
absolutely, luckily most multivitamins do have some vitamin D in it. But if we take a look and typically vitamin D is under 30, I definitely want you to be treated. Try to, maybe be in more of like the 50 to 70 range once you do start treatment. But I was going to ask about the curcumin in terms of like, what are some curcumin rich foods? I think you had it on another slide. Turmeric is
Yes.
one.
So turmeric is I believe, curcumin is found in turmeric. So it's
Oh,
a
okay.
root. It's kind of like, I'm not sure if you've seen it, but you've probably seen it at a grocery store. It looks like ginger, but when you cut
Yeah,
it
like
open, it's
orange ginger.
orange.
Yeah.
Yeah, and it does have a particular flavor to it. It's actually very common in Indian cuisine.
Hmm.
But I think it could be great in curries, and you'll see the recipe that I recommend includes turmeric. But again, in a pill form and in through food, the best way to consume it is with the addition of that pepper because it really brings out it makes it more bioavailable and
Oh, okay.
you have a better absorption rate with it. Um, but for some people who just don't like it in food, it's another option, and especially when you're getting anything from a supplement form, it's often much more concentrated. That's not always better, but it can be a very potent anti-inflammatory supplement. And I'm so happy that you mentioned that, getting your levels checked is great. I love that you mentioned the amounts. Typical prenatal vitamins that I recommend usually have the 2000 IUs, which is a great starting point. Making sure that you take your vitamin D after you have some food in your system is really critical. Also, vitamin D and vitamin E, they're both fat soluble, which means you require fat in your system to have them. So they're much better taken after a meal. And then the melatonin, I think most of us know melatonin as like that sleep aid, but it really is also this powerful antioxidant and a hormone that can have great anti-inflammatory properties. It can potentially help with pelvic pain. It could potentially help regulate estrogen levels. I just came back from a health conference, and melatonin was like the big thing, also for mental health. So I'm really intrigued with melatonin. I want to do more research on it. So there's a lot of options. I didn't mention them all. There's also zinc can be helpful, another key antioxidant. But these are the main ones that are out there. And then leaving you with a very simple recipe. My whole philosophy is if it's going to take more than, 15, 20, 30 minutes to make, it's really difficult, especially for the average person that I meet who's a New Yorker, very busy. Very simple recipe, but it's including three of the components that I mentioned: salmon, avocado oil, turmeric, and then even I guess the garlic also is very healthy, and the black pepper. So an easy recipe to make, and I would pair it with some of those vegetables that I mentioned before that have those health benefits, the anti-inflammatory, the antioxidant benefits, the sweet potatoes, which are really rich in beta carotene, and the Brussels sprouts and the broccoli, which are very high anti-inflammatory foods. Very easy thing to make. Also great as a leftovers the next day.
It's
So
like the perfect meal. It's so easy for
yeah,
leftovers,
and
easy to
don't worry,
cook.
you don't need to memorize this. We're going to be sending everyone today who's attending the slides so you have access to this recipe.
So absolutely. Well, we're so excited that you guys hung in there with us. We hope that you learned a lot. We hope that this was helpful. Just a few takeaways. Inflammation is a natural process, but yes, it's possible to have too much of this natural thing. And so managing the sources of your inflammation is always going to be your primary goal. But then making sure that you're taking care of yourself kind of in a 360 way. What's going on with my diet? Are there things in my lifestyle that can be used to manage your inflammation? Being really mindful of nutrient balance. I just love, love, love. If you don't already follow Dara, you need to follow her because she cooks the most amazing meals and has a very nice spread, just like a variety of things. All of us, can have the possibility of just falling into eating the same 3 meals. But then there's no diversity in your diet and what's being offered in the nutrients. And so really starting to think about that a little bit, grabbing something that you wouldn't normally eat and kind of figuring out how to work it into your diet is important, as well as, paying a little bit more attention to which supplements you're taking or may need. And then, I'm always going to urge you to seek medical and nutritional advice from professionals. TikTok has lots of great ideas, but not always the best source of information. And so really do seek out professionals like ourselves to, always happy to talk about these things with you.
I love that you said that. I think it is so important to seek guidance, especially to get customized. Everyone has a different body, everyone's different. So it's really important to really seek out some customized support from professionals that really can help work with your lifestyle and your particular condition.
Well, if you guys have any questions, please use the Q&A function. You can add questions there. There are just a few that I'll answer, and if there's any others that are coming in, we have some time to answer for you. So first question just reads, do fibroids cause swelling in the legs? How long after a myomectomy should you see significant reduction in swelling? If you see minimal improvement, what should you recommend to do next? A vein specialist. I would always start with maybe going back to your fibroid surgeon, because they could let you know maybe what were the intricacies of the surgery. Any kind of pelvic surgery can increase the amount of swelling you have. There's disruption of lymphatic drainage and all these different factors that make it a little bit more, your body just has to heal. Surgery itself causes inflammation, but that inflammation is necessary to keep infection away and to help your body heal. And so sometimes you might need additional adjuncts like massage or compression hose, just until you recover long enough. I think that most people will, see the minimal improvement in the first few months after surgery, but I would definitely recommend to reach out to your surgeon to see if there was anything else, that either occurred during surgery or that you need to know in terms of like your healing journey afterwards. The next question is, how does one rule out having endometriosis? How is it diagnosed if one may not have pain with menstruation, sex, or urination? This is a great question, because not everyone has the classic symptoms, or may not have like put all the symptoms together, which is what I find. Because sometimes the first time we're finding out there's presence of endometriosis for, people that I see in the office is with pelvic imaging, like a pelvic ultrasound. And if something maybe looks abnormal on the ultrasound, or their symptoms to me sound very similar to someone who has endometriosis, then I may recommend more advanced imaging like an MRI of the pelvis. And previously the only way to really diagnose endometriosis was with surgery. You had to have a surgery where you visualize, you looked inside the pelvis, you looked for those little endometrial clumps of tissue. They have very characteristic ways that they show up in the tissue. What we call burn spots or these white lesions. It's really kind of like different manifestations of scarring. Or with these cysts in the ovaries, which were called chocolate cysts, because if you injured it or you opened it trying to remove it, the inside contents were very dark. And so, those types of surgeries were once upon a time were the only way that endometriosis could be diagnosed. Now we do kind of incorporate a bit of a clinical assessment to either having suspicion or to confirm endometriosis with imaging, based on factors that are present. And so I would say if there's any concern, maybe start by seeing your gynecologist, talk to them about your symptoms, and see if maybe a pelvic ultrasound, at least as a starting point, could be helpful. Next question is, where does endometriosis come from? Why and how does it start? This is really, really interesting, because I will tell you that the answer is not completely known. There is a genetic component to endometriosis. So sometimes women come and say, my mom had a hard time having me, she had endometriosis. I'm like, oh, okay, well, let's look at that. Or your sisters or all the women in my family have this issue, then I definitely want to kind of look into that. Some people might not have that, if their parents weren't ever diagnosed, but everybody has terrible periods, or your young person in your life is, having terrible periods, painful periods, that they have to miss school or they can't go to work, or things like that. Yes, many young people may be put on contraception to relieve these painful periods, but it's also worth asking, could this possibly be endometriosis? Where it comes from, there's a few different kind of theories about it. One is called retrograde menstruation, where instead of all of the cells exiting the uterus through the cervix, some of the cells kind of float free and maybe go into the fallopian tubes and float out of the fallopian tubes and take up residence in other places. It's still not explaining everything, because probably everyone has retrograde menstruation. It's not uncommon if you actually do a surgery on someone around the time that they're menstruating, that the peritoneal fluid looks a little hazy, it looks a little bloody. So that lets you know that in many women, it probably exits that way, but the tissue does not stay there and stick around. So there's something pathologic with the cells of people who have endometriosis that allow the tissue to kind of hold on, hitch on to a tissue that's not its host, and kind of like stay there. And so why we don't like 100% know, what causes it and where it comes from, I think it's important to know if there's any family history and if you have any suspicion based on your symptoms to definitely talk to your provider about could this be endometriosis. The next one I think we have is for you. It says,
Yes.
what do you recommend instead of curcumin if you're allergic to cumin? Are they related?
They're not related. So I'm happy that you mentioned. So curcumin is, as I mentioned before, is the main component, the active component that's found in turmeric. And turmeric is a spice. I mean, it actually comes from this plant, which looks very similar to a ginger, but when you cut it open, it's orange. I think where people can get a little bit confused is, it's mainly found in in the turmeric, but it also can be found in like curry powders. So various curry powders may also have cumin in it. But the main source is coming from turmeric, and or lesser source coming from curry. So if you're allergic to cumin, that is fine. You could still have your turmeric. You could still have your turmeric pills, your curcumin pills. That's fine. And the next one, are you both open to new clients, patients? I definitely am. Through RMA, if you are an active patient at RMA, my services are definitely offered to all RMA patients.
And goes the same for me, always accepting new patients, of course.
Um,
Let me see. Any tips for lowering estrogen dominance when you have Hashimoto's? Hashimoto's thyroiditis is a condition, it's an autoimmune condition by which you're making antibodies to your thyroid gland. And because of this kind of bombardment of the gland with antibodies that are directed to your thyroid, over time, your thyroid, kind of starts to slow down. So people with Hashimoto's thyroiditis, it is, lifelong kind of management. Some people may need medication, some people may not. Some people may need medication in the future, but it's important for them to know. I think, with estrogen dominance, it's a little bit different. Not necessarily that you want to impact the hormones. You want to take your medication if that's indicated. But I think all of the tips here are important in terms of reducing your overall inflammation, trying to manage your condition with any medication that's been prescribed, looking for other ways to really, limit inflammatory conditions as much as possible. If you have other chronic medical conditions, looking into your diet. I love the conversation around maybe lower impact exercise. I think everyone thinks you have to be very aggressive with your physical activity in order to be healthy, but moving more towards consistency with a low impact, regimen can be really, really great too. So I think that's a good one.
Yeah, I was going to just add to that, in terms of nutrition, as I mentioned, those antioxidant rich foods can be helpful with estrogen dominance. So, the foods that are rich in vitamin E and vitamin C, selenium, zinc, those are often when I see someone with Hashimoto's, I really try to reinforce those foods. And then on the other side, the foods that can increase the inflammation, you may want to consider lowering like potentially gluten or dairy. But really, I like to focus on more of the yeses rather than the nos.
I love that. Next one, if there's suspicion of silent endometriosis, do you recommend a laparoscopic procedure to confirm diagnosis and potentially treat, or do you recommend moving on to IUI or IVF? Once upon a time, we did surgery on everybody. We were looking for silent endo with everybody because we knew that, endometriosis tends to lurk amongst people who are trying to get pregnant without, sometimes with symptoms, sometimes without. And, we did the surgery. Surgery itself puts you at risk, and so we really, as the advances in assisted reproductive technologies has increased, we started to slow down on the more invasive things like doing a surgery just to confirm endometriosis. I think it's a little bit different if you're having symptoms, if there are other compelling reasons. But now we tend to say we have so many different ways, especially with hormonal medication, to modulate the endo to increase your chances of live birth. And so typically, if there's no overt endometriosis and silent endo is suspected, you can move into treatment without having to have surgery first. Next question is, can inflammation affect getting pregnant? Have a lot of body pain, and my doctor has me on low dose naltrexone to help. It said it could reduce inflammation, might help with pregnancy later. We didn't really touch too much on naltrexone. I know it's a little bit buzzy. I don't think there's really good information on taking this medication chronically in order to get pregnant. I think as pain management, and I know some rheumatologists may be using it in terms of anti-inflammation, but I think the jury is still out on whether or not that medication can, improve your chances of getting pregnant. Chronic inflammation, it can impact your pregnancy rate. And so doing what you can to reduce it, I think is important. And so working with your team and your doctor might be the best way to do that. And then I'll say for the last one, open to new clients. Sure, both of us are definitely seeing more patients and always happy to, work with people kind of where they are and what their needs would be. I would say would you say if one had a myomectomy, endometriosis can be ruled out, given the surgeon can visualize the uterus and rule it out? Typically, yes. During these kinds of surgeries, we are kind of surveilling the pelvis, looking around. I would think that if there's some overt endometriosis, there'd be scar tissue present, there may be lesions present. And so if you ever have a doubt, you can obviously talk to the surgeon who did your surgery or review what's called an operative report, because this details every single thing that we saw during surgery. And if there's a suspicion of endometriosis, a lot of times we take that little section as a biopsy and send it to the pathologist so they can tell us if there's endo or not. And so, yes, I would say in general, if one has had some sort of open pelvic surgery, a gynecologic surgery, then we're looking for those things as well.
And I just saw someone just added, any thoughts on acetylcysteine or alpha lipoic acid as supplements? Yeah, there is a little bit of research on N-acetylcysteine that I saw, but not enough to really, I didn't add it. I was thinking, I'm like, should I add? But again, there's not enough confirmation in the research that I felt comfortable to add it in. Do I think it would hurt? Probably not, but do I think it's necessary? Like the first line of all the supplements that I recommend, probably not. Alpha lipoic acid, less so. But again, there's a little buzz and talk about it, but not enough where I feel comfortable to really add that onto the list. So I feel like we've done a lot. We've hopefully provided a lot of information on this topic, and it was such a pleasure to speak with Dr. Jackson-Bey. And hopefully all of you really got a lot more knowledge on this topic. And we are here for you. We are accepting new patients. And thanks for being patient with us and meeting with us on, I'm sure, a very busy Wednesday night. So.
Yes, I love it. Well, thank you so much. I think this was a terrific idea. I'm so glad it came together. And I would say for anyone who has feedback, let us know what you'd like to hear next.
Yes.
Dara's already done a series, which is incredible, about fertility diets, veganism, lots of different things. So if you have kind of questions, concerns, or ideas for future diet and nutrition related topics for our webinars, let us know.
We're here.
All right. Have a great night, everyone.
Good evening. Bye.